So let's get back to the things that are, very close to my heart, which is your IPS, which is your interpersonal skills, right? How can we improve the interpersonal skills? We can improve them. What are they, first of all? These are all those skills that will really help you to get the best outcome to your interaction with patient. And by best outcome, I mean best for both, best for the patient, which means the patient leaves happy, the patient leaves satisfied, they feel like they were listened to, they feel like their needs were met. And best for the doctor, which means that they don't end up doing something that would might be unethical, or they don't end up saying no to the patient but upsetting the patient and then having a complaint after that. So, it's a happy doctor and a happy patient, and that's the best outcome we can hope for, right? So, a lot of it is obviously based on your communication skills. And we must remember that communication, verbal is only part of communication. A large part of your communication is your non-verbal and even your paraverbal. So, paraverbal is again how you pitch things, how you pace things, your volume, how your expressions, how your tone changes. And when I do teach my students, I even tell them, I teach them how to use these. These are very powerful tools which you can use when you're, for example, breaking bad news, when you're about to tell a patient about a medical error, when you're about to, it's that kind of warning that, things are going to be changing. I need to tell you something important. Sometimes it's so powerful. And of course, your nonverbal skills, your nonverbal communication is perhaps the most important. Your expression, your eye contact, your posture, things like that. Obviously, when you're on a telephone consultation, then it's mainly your verbal and paraverbal that matters. But it is really important, and I really, really help my students to build these skills up. I give them feedback on how to improve these individual skills in if they are weak. Rapport is very, very important. And again, rapport means showing the patient very early on that you're on their side, you're on the same side, you're not against them. So, for example, how you respond to a patient when they come in saying, Doctor, I have this cough and I need antibiotics. Now, you could say, okay, well, I'm the doctor, let me decide if you need antibiotics. And that would be like a really bad rapport, really poor communication. Um, that would be very doctor centered. Or you could tell the patient, okay, when did the cough start? How long have you had it? Blah, blah, blah. And kind of ignore their request of, I need antibiotics, just kind of not acknowledge that. And again, that wouldn't be great IPS, because you're not really listening to the patient. You're not really, the patient's going to feel uneasy that this doctor's just ignored me saying I need antibiotics. They'll keep bringing it back up. Even though in your mind, you're thinking, well, how am I going to decide if I need to give you antibiotics if I don't ask you more questions about the cough? But you haven't conveyed that to them. You haven't communicated that to them. So they're not sure. They keep thinking like, will they give it to me or not? Some people will say, okay, first I need to ask you some questions. And then they'll carry on asking questions, which is, I would say, tiny bit better in terms of IPO because at least you've let the patient know, like, okay, I heard what you said, but first I need to ask you questions. But then you can have a really, really good way of showing the patient. You could just say, let them know you're not opposing them. Let them know that you're not like against them. So if a patient comes in saying, Doctor, I have this cough and I think I need antibiotics, you just let them think you're on their side. Okay, I understand. And if antibiotics is what you need, then I'd be happy to give them to you. Right? So immediately you've diffused this patient's stress and anxiety and like, thinking that they're going to have to come in and fight you for it and that you're going to be against them. You've immediately made them think, well, if antibiotics is what you need, then I'll be happy to give them to you. However, for me to decide if antibiotics is the safest and most appropriate thing for you, I'll need to ask you a few further questions. Is that all right? Yes. So that way you've let the patient know, look, I'm on your side. I'm not opposing you. I've heard your request. I'm quite happy to comply with your request as long as it's safe and appropriate for you. And obviously, every patient would want the doctor to do what's safe and appropriate, right? So you can really, really enhance your rapport in that way. So there's the art of how you put a patient at their ease. There's an art of how you communicate with them. So that right from the start, you can, it'll be very easy for you to progress because the patient will already be on your side. Okay. Understanding each other, acknowledging, making sure that you've not just decided in your head, okay, I think I know what they want. I mean, sometimes, people say, oh, these notes said, that if there's a request for a sick note, then we should never give it. Or if there's a request for antibiotics, we should never give it. And but they unfortunately end up conveying that to the patient. right? But don't have that. Have an open mind. Just be very, very open to listening to your patient, to absorbing everything, active listening. So whenever they're giving you some information, really registering it in your mind, absorbing it, and even sometimes acknowledging and reflecting it back to the patient so that they really know that you've understood and heard them. You're not just kind of like talking to yourself in your own mind, you're actually talking to the patient, right? Being patient centered. So responding to them really appropriately and sincerely, not just kind of like if the patient says, yes, my mom passed away of breast cancer 2 years ago, and you're like, okay, I'm very sorry to hear about that. Please, accept my condolences. So apart from your breast cancer, has there been anything else if you're going to talk like that, it doesn't look sincere. It doesn't look heartfelt. It just looks like you're just saying these things, right? So you have to have that kind of patient-centeredness, that empathy, that, warmth, that real sincerity. Validating, again, very, very, very powerful tool. When somebody's upset or somebody's angry, and you just keep kind of ignoring that sentiment, and a patient keeps saying, I'm really angry, I'm not happy with the way my mom's been treated, and she came into hospital and blah blah blah. And all you say is, okay, what was your mom's diagnosis? So what were her symptoms? When did she come in? What happened then? You just go clinical. You're not really validating this patient's upset or angry. But if you take that moment to just say, I can see you're really upset, and you've done the right thing by coming to talk about it. I'll do whatever I can to help you and try and fix whatever you feel has gone wrong. But for that, I'll need to ask you a few more questions. Is that all right? And then you start asking them questions. They're going to be much more likely to respond favorably. They're going to be much more likely to, feel, that it's kind of more valid. I'll answer those questions later. I would just like to get through this section if that's all right. Just acknowledging the agenda and conveying what you do for them, really establishing that good connection. I always say just establish that connection with the patient. And that is what rapport is all about, right? Don't just say things. Don't just ask them, what are your ideas? What are your concerns? What are your expectations? But then don't know anything about them later. That's just empty words. You're just picking things on a checklist. What we really want is for you to be doctor-centered, so you follow through with those. You come back to address those concerns, right? And I've already mentioned empathy. Empathy is such an important thing to have. Just showing your empathy. So the patient's telling you, doctor, I've had this terrible pain. And you just say, where exactly is the pain? How long has the pain been there? Is anything making it better? Is anything making it worse? These are all correct questions. But where did the empathy go? If they're telling you I have this severe pain, so I'm really sorry to hear that. That sounds very distressing. How long have you had this pain? So you could just kind of, show that little bit. It doesn't take long at all. It's not going to waste your time. But you could just really, really kind of, explain that, you could show that empathy. So how do you improve your IPS, guys? Now, obviously, I like to believe that I've helped tons and tons of students improve their IPS and help them pass their exam with flying colors. Because a lot of them are very good clinically. That's what we're really good at. We're really good at learning stuff and memorizing stuff and knowing stuff. But we're not that great at communicating, and that's the difference. This exam is a different exam to any other you've taken in your life because this is all about communicating. So a lot of students have struggled with IPS. They know their stuff, but they're just not good at putting it across. So I've really, really helped them and worked with them to improve those weak areas. And I'm really proud of them and I'm really pleased to say that they're really, really improved with their IPS. Um, there are different things. You can make sure that you practice with somebody who's got good IPS, who can give you good feedback. Some people are very conscious. You can record yourself, see how you do. Asking different people, don't just study with one person all the time because they'll only be able to pick up on limited things. Maybe, your friends don't even realize certain things you do might be, not that good. Um, always try to keep improving. And again, you don't have to wait till you do a course and you don't have to wait till you actually start studying. IPS is, skills that you can apply to everywhere and everything. You can apply it with your friends and family and, strangers on the street. So, you can always just try and practice. Also, I would say try to practice more kind of non-verbal IPS, trying to practice because you don't want to be wasting a lot of words on saying lots of long sentences for IPS. It's not about that. Try not to use stock phrases. Again, there's some very cliched phrases which people use, which again sound very unnatural and unsincere. So try to have like your own natural kind of style and empathy. I talk all about receive and summary statements in my course. Unfortunately, we don't have time to go into that. But above all, just having that really good, strong connection, that empathy, listening to your patient, responding appropriately, trying to take on board their concerns, being patient-centered, giving them a chance to talk, asking them questions, and that just really, really having that good connection. And it can really help you a lot with getting through.